Thank you very much for this opportunity, Erica, and the rest of the panelists, and for LIF to give me this opportunity to just share a bird's eye view of what it's been like here in San Francisco. Wu Yi is a early Head Start grantee, the largest in San Francisco. We have 12 centers throughout most of the different neighborhoods in the city. We also are a resource and referral agency. And on top of that, we do a family resource center, and we have a family childcare quality network of about 105 family childcare homes that we support with training, consultation, and coaching. So we do have a good grasp of the whole spectrum of the system, excuse me. So I'm going to talk about a couple of things. One is the immediate response that our field took here in San Francisco. And you know, we're really fortunate, and of course, because we are such a high-cost county, the city and county of San Francisco has long recognized that the state and federal supports that most providers get through those contracts aren't enough to successfully run and sustain high-quality early education facilities, both in family childcare homes and in Title V centers. So we have what we call an early learning scholarship in San Francisco that's funded through the general fund in the city, and also through another proposition that was passed, the Children's Fund, years ago. And this provides an additional layer of funding for all of us, for qualified children and providers who are in the system. That said, you know, we're still very much in the throes of the response to this pandemic. And we were very, again, grateful and appreciative that the CDE funding, as well as our local early learning funding from the city and county of San Francisco, was extended through June 30th. Now, our local funding, we still are waiting to see if we'll get extended through the end of June for that. But we've had funding consistently through the closure dates of April and May. So that's made a big difference in us being able to keep our workforce employed for distance learning and for doing a lot of the other social and physical supports that Giannina mentioned in terms of diaper delivery and food delivery and mental and emotional support, circle times with children virtually, doing all of those things to keep the system together as much intact as possible during the stay-at-home orders and the closures. One of the first things that our San Francisco ECE leadership did was convene a group of emergency ECE operators. And we've had a steering committee of this group meeting daily since the closure. So I'm on calls every day with our local director of the Office for Early Care and Education. First 5 LIF representatives join the calls. We have a representative from the R&Rs, and also I represent the Head Start and the Title V providers. So we've been, you know, really working on this since the very beginning, trying to get up emergency childcare operations. And thus far, we've been able to operate 11 centers and 3 family childcare homes to serve essential workers, a combination of hospital workers, other essential workers, and people that are in extremely high-risk populations. We've served, of all those, we've only been able to actually provide care for about 135 children within those emergency operations. Now we're doing the next phase of the reopening task force, which is really looking at, as things begin to open up and as more essential businesses are allowed to open, more services being allowed to be delivered, more people going back to work in qualified eligible businesses, that means we have a greater need for childcare. So we're looking at what is it going to take for us to open up on a larger scale. There's 3 main components to our reopening task force that we've been studying. One is enrollment and supplies. What sort of enrollments will we see given the broadening availability of folks into the workforce? and what are the supply needs that we have, being the essential pieces to safe reopening, and parents as well as teachers and others feeling that this is an environment that is safe um, to operate during, still with very many questions about community spread and transmission, et cetera. So that's the first subgroup of the task force. The second subgroup focuses on instructional support and mental health supports. What's going to happen? What sort of different supports are going to be needed in the classrooms, in the family child care homes, to give the children the maximum quality educational experience that they can get during the different circumstances of their classroom configurations. And then third, we focus on let's see, and we also talk about the fiscal modeling and what financial supports need to occur in order for families and centers to continue, family child care and centers to continue to operate. So, and then the workforce, I'm sorry, that's the other piece of it, is really looking at what are we going to do with a workforce that is both still somewhat delayed in terms of being able to come back to work because of vulnerable populations or their own childcare needs. So we have less teachers available to staff those classrooms and those centers. And all of these are really the linchpin issues that will drive the amount and the sustainability of the childcare system in San Francisco, and I think across the state. These are issues that are common to all of us when we're thinking about reopening. Do we have the supplies? What kind of enrollments are we going to be looking at given the new guidelines on reduced class size, et cetera, and social distancing within the classrooms and the family child care spaces? Do we have the workforce to be able to provide this? And do we have, you know, the educational supports and the infrastructure for the teachers, the instructional and mental health supports? So I guess I need to wrap up.
Yeah.
I'll tell you that it's a big lift. We know that from the modeling that we've done, we are going to be operating in San Francisco at 51% of our licensed capacity for centers and about 69% of our licensed capacity for family child care homes. That's what it's going to look like.